I'm here with Jon Levoy, Vice President of Business Development and Technology at Alego Health, to discuss electronic medical records and Alego Health's role in this complex and ever-growing field. Jon, thanks so much for joining us.
Thank you.
So there's been a lot of discussion about electronic medical records, government involvement, and how they're both being used. So can you explain a little bit about electronic medical records and how they pertain to both hospitals and patients?
Yes. Well, electronic medical records are replacing the paper records that traditionally hospitals have used over the last 100 years of medical science. So what is going on is in 2009 there was the High Tech Act, which actually asked the hospitals to move toward electronic medical records. There are some benefits to the hospitals for moving toward those. They're called meaningful use. When their physicians are actually utilizing electronic medical records, the hospital itself gets bonused by the government, so it's a funded program. And then in each one of those meaningful use pieces, the government will actually put in money into the hospital. So it's actually beneficial for the hospital to get their physicians where they need to be. It also is beneficial in the long term as far as storage and data. It's much easier to store data than it is to store paper, especially with the patients and coming in and utilizing their doctors and their ancillary facilities inside of each hospital. From a patient's perspective, it's obviously a very good thing because they're able to log in and get their information from their doctor, communicate with their doctor via electronic media, and actually get information quicker and faster.
So it sounds like you're really just simplifying this entire process.
We are, and what it also does, it acts as an opportunity for mistakes to be corrected quicker, to realize mistakes where paper in the past where you'd have to carry your chart from one doctor to the other, doctors are able to share information with each other.
So what is Alego Health doing to provide support for the hospitals and physician offices?
Well, Alego Health provides implementation support. We provide meaningful use documentation, and we also provide training, consulting, and we also do some other pieces of the electronic medical records as it pertains to the technology and the training of those electronic medical records. We also work with certain parts where we actually work directly with physicians as physician support trainers. We work directly with nurses with our informatics support trainers, and we also do pre-implementation, go-live support, and do builds for the actual electronic medical record itself.
Now, you just mentioned PSTs, so can you explain what a PST actually is and what their role is in the implementation of electronic medical records?
A PST is a physician support trainer. Physician support trainer works directly with the doctor. We work with them prior to go live to make sure they understand the process and the actual program itself. And then we work with them all the way to the actual go live, which the go live is really just flipping the switch. That you go from one day to the next and you're working on a program and then you're not working on another one, or you're implementing a new program. So a lot of doctors will have some hesitance toward that because they're used to working with paper records. So we work with them through that process, get them comfortable, get them all set up. So when the switch does get flipped, we're able to go right into that and they're able to continue their workday and be more productive. So our PSTs are really designed for creating a better environment for the physicians so that the physicians themselves can utilize the program at the optimal level.
So we know that training is a huge part of electronic medical record implementation. How is Alego Health positioning itself to ensure proper training and continuing education?
Well, we continue to train our trainers all the time. We actually also built a new classroom in our new facility, which our headquarters is in Westlake, Ohio, where we actually are continuing to train our people and continue to grow their education inside the electronic medical record. The thing with the electronic medical record is each individual electronic medical record, while it might be the same program for one hospital to the next, is designed and built differently. So each hospital has its own set of problems and concerns and things that they want to accomplish. So one of the things we try to do is get some base knowledge for our trainers and then also provide individual client and hospital information for each one of our specific projects so that our trainers are well equipped in order to go in and do all the things necessary for the hospital to be successful.
Wonderful. Well, thank you so much, Mr. Levoy. We have a ton of good information about electronic medical records. So where can people go for more information about Alego Health and electronic medical records?
Well, you can visit our website, which is www.alegohealth.com, which is ALEGOhealth.com, or you can also call and ask for myself or any one of my staff. And our phone number is area code 440-617-6516.
Thank you so much.
Thank you.